What's up, everybody? Dr. Bonzo back. I'm outside. It's starting to rain, so I got to hurry up. You know what it is, a medical topic in 5 minutes or less. It's about to start raining, so I may do it in 3 minutes or less. Real easy topic. Follow up on our talk from a few days ago on migraine headaches. Today, we're going to talk about cluster headaches. Now, if you remember, I said that migraine headaches last between 4 and 72 hours. Cluster headaches are much shorter duration, between 15 minutes and 180 minutes. So anywhere from 15 minutes to 3 hours. Remember, we said migraine headaches are more common in women. Cluster headaches more common in men. For you test takers out there, I have literally never seen a test question on cluster headaches where it was not a man. Now, you also may remember we talked about the International Classification of Headache Disorders. For migraine headaches, you have to have at least 2 of those qualities of the symptom and also 1 associated symptom. Cluster headaches is kind of similar. The main symptom that you have to have is it has to be unilateral, meaning one-sided. So remember, cluster headaches, always one side. If you don't remember that fact, you will miss like half the test questions on cluster headaches. Now, in addition to being unilateral, they have to have 1 of the associated symptoms. That could be several things, and they have to be on the same side as the headache. So either lacrimation, which is the eyes watering, rhinorrhea, which is nose running, also things like ptosis, that eyelid kind of lagging, miosis, dilated pupils, or either sweating on that side. So think about sympathetic nervous system symptoms on that side that you have the headache on. And again, always unilateral. And again, much shorter duration, between 15 minutes, 180 minutes, and always men on tests, and usually men in real life. I've actually never seen a woman with a cluster headache, although I'm sure it does happen. Now, next thing is, what about treatment? Well, you remember we said that with migraine headaches, we had abortive therapy and prevention. For abortive therapy, we talked about Triptan medications or either NSAIDs for mild symptoms. For cluster headaches, it's kind of different. Really unique treatment options. The big unique treatment option is oxygen. So using very high flow oxygen, between usually about 12 liters of oxygen, or using a 100% non-rebreather is a very good treatment for cluster headaches. The number needed to treat is about 2. So for about every 2 people you treat with oxygen with cluster headaches, at least 1 of them will be headache-free within 15 to 30 minutes. Now, the other options, if somebody doesn't have oxygen therapy, which sometimes is kind of tedious to set up for people and to get approved by insurances, but you can use those same triptan medicines we talked about with migraine headaches. Now, one thing to be aware of is that let's use the example of sumatriptan. Sumatriptan, which is known as Imitrex, comes in 3 different forms: oral, which is pill form or PO. It also comes as a nasal spray and also as a subcutaneous injection that you can do. Now, in order, the subcutaneous injection works the fastest, and that's a little bit faster than the nasal spray, which is faster than the pill. So injection the fastest, spray second fastest, pill the slowest. Now, the thing to be aware of, if you use intranasal triptans with cluster headaches, you have to use it on the opposite side of the headache. Remember, those patients often have rhinorrhea, runny nose. So if you actually spray it on the same side as the headache, that congestion may actually impair absorption. So the last thing to talk about is prevention or prophylaxis. The main prophylaxis, remember we said for migraine headaches, you had TCAs like amitriptyline, you had non-selective beta blockers, medication like that. We had gabapentin and riboflavin as second-line agents. We also have valproic acid and topiramate as first-line agents for prophylaxis for migraines. For cluster headaches, the main thing that's been showing the best at prevention is verapamil. So remember we talked about that medicine previously on our calcium channel blockers video. Verapamil is a centrally acting calcium channel blocker, so it can lower your blood pressure and lower your heart rate. So be careful using this medicine in people who have low blood pressure or low heart rates. And also, one other caveat about verapamil is that you have to use it at relatively high doses. It usually doesn't work for cluster headache prevention unless you're using at least 240 to 360 milligrams a day. All right, that's it. Cluster headaches actually in 4 minutes or less. See you soon.